Researchers found that pulse oximeter tools may not accurately measure blood oxygen levels in non-white patients with COVID-19. Black and Hispanic patients were more likely to have unrecognized or delayed recognition of eligibility for life-saving COVID-19 therapies. A retrospective analysis of over 7,000 patients with COVID-19 found that pulse oximeter devices, tools that measure oxygen levels in the blood and that are used in virtually every US hospital, overestimated blood oxygen levels in non-white patients. The inaccuracy made these patients appear healthier than they were and delayed recognition of their eligibility for specific COVID-19 medications recommended by the Centers for Disease Control and Prevention. At sea level, most people's blood oxygen levels should be from 95% and 100%. Patients with COVID-19, which causes oxygen levels to drop, are at high risk for becoming sicker if their levels go below this range. The analysis team looked at patient data gathered from the Johns Hopkins Precision Medicine Center for Excellence for COVID-19. Initially, the team focused on over 1,200 patients with COVID-19 who had concurrently been given two tests that measure blood oxygen levels, pulse oximetry and arterial blood gas (ABG) tests. By means of a clip-on device, a pulse oximeter device indirectly measures a patient's blood oxygen levels using wavelengths of light. Conversely, ABG tests require a blood sample for a direct measurement. Most patients take only a few, if any, ABG tests during an extended hospital stay. Medical practitioners more frequently use the non-invasive pulse oximetry method. The team compared the patient's ABG test results to the pulse oximetry results and found that pulse oximetry overestimated blood oxygenation in racial and ethnic minorities. Compared to white patients, pulse oximetry overestimated blood oxygen levels by 1.2% for black patients, 1.1% among non-black Hispanic patients, and 1.7% for Asian patients. To estimate the effect of this bias, the team then looked at over 6,600 other patients with COVID-19. By applying a statistical prediction model, the researchers found that more than one-fourth of these patients, the majority of whom were members of racial or ethnic minorities, probably qualified for additional COVID-19 therapy before the pulse oximeter identified it. Overall, the researchers found that black and non-black Hispanic patients were respectively 29% and 23% less likely than white patients to have their treatment eligibility recognized by pulse oximetry. The team believes the device's biases could be potential explanations for disparities in COVID-19 outcomes and may have implications for the monitoring and treatment of other respiratory illnesses. More studies to determine the clinical consequences of this bias are ongoing.